way. Okay. And then I do the ones down here too. I twist it like that.
Lean away.
Oh!
So you've never been to a chiropractor then?
Never.
But I
just self-cracked all the time, all day.
I'm not gonna have you show me, but maybe towards the end, if I miss any, you can.
Okay.
We can let you do the honors. Right. What were you saying about your knee, though?
My knee, like sometimes to crack it, like I have to twist it. I don't know if it's out of place.
Why do you feel like you need to do it?
I don't know.
Where do you feel it?
When I crack it?
Yes, the pop. On the outside?
No, I would say on the inside.
Interesting. Well, you're gonna like today because we're gonna
Okay,
find all kinds of ways to pop. To the right foot flare. Outside, you have to do something weird because you're already kind of standing here like that, and you're walking a little bit like that. What is this?
Is this from like how I sleep?
This is from forward head posture. You're looking down at your phone, looking down at your hand. All of us have eyes on the front of our heads, right? Hopefully. And so when we look down, that puts an extreme amount of force on the neck. A little bit of swelling up here. Let's check the right side. I'm curious. Chin back toward me. Nope, there's your right atlas right there. Are you taking your chin to the side, the left?
I mean, I do both sides.
Does one go more than the other? Does the right side
They're about
go?
the same.
Because the left side feels all swollen.
It's called wellness visit. Like literally her paperwork said nothing.
I'm here for the experience.
Yes. I watch your videos and it's just like, I feel like my back is like, it feels like it needs to be cracked every time I watch it.
Oh, is that what we're doing to everybody? It's a great commercial. Just one big long commercial for chiropractic. Ooh.
Yeah,
It's not. Yeah. It's all right. It's better to get this done early in life and wait till you're older. Ooh, okay, you mind me going a little bit more rough? Here
That's
we go.
fine.
Get rid of that scar tissue there. Ooh. That's some. Okay, let's get rid of some of the shoulder issues. T1. She's tough. She's tough. There we go. Hey, excellent. You ready?
Yes.
All right. Yeah, that right there. Perfect. You happy?
Yes.
I'm happy. Nice flexibility right here. There it is. Took me 2 times. Very good. So how was that letting somebody else take the wheel?
It was weird. I think it feels about the same when I do it.
So.
Sometimes I feel like I don't get it high enough is the problem.
What is that? What is that meme? Is it a meme? I'm sorry. What is it with Kermit the Frog and he's like drinking tea? All right. And then you did say you have some allergies.
Yeah.
Do you have it right now?
Well, I had like a sinus infection. I've been taking antibiotics for it. It's going away, but I still have a little congestion.
And here's the frontal sinuses right here. We got 2 here and 2 big ones here. Right here's one. I'm gonna push.
Okay.
Okay, there's 2. Those are the maxillary sinuses. And they kind of flex. They kind of, when they're filled with fluid, you can drain them. Okay. Then there's 2 up here. Just 2 like little triangular ones. Right here. Okay, and you just kind of open them up. And then we do the other one. But it's better if you're sitting. I'll show you guys in a sec. Yeah, you have a little bit more on the right. Not as much on the left.
Yeah, I feel it.
Yeah, right there. I'll get to it. Ooh. Really? I got 2. Oh no.
It feels like they want to crack.
There's another way that I've been adjusting the toes, and I'm probably gonna have to do that on you.
This way.
Okay.
And then I do the ones down here too. That one's not going.
Good job. Oh, very good. And then again this side. Perfect. You're like, I didn't know any of that was possible. That is possible. Ears. We're going in a weird order today. Lean away. Good. Lean away. Oh. Very good. Woo. Lean away. I think it already went. Yeah, I don't want to pull too hard on it.
What do the ears feel like?
I don't know. It's just a weird sound.
It should feel like like when you said sinuses, it should feel like a little open.
Yeah, it does.
Yeah. It's good.
But like my knee right now, I feel like I could crack it. So I crack it or no?
It's better if you do it in here and I can see
I
it.
twist it like that.
Okay. And you feel the crack right here?
Yeah, like
right
here.
there. Yeah, I mean that foot does wing out. And I think what's happening is because you're stepping on it with your foot out, it's a little loose.
Okay.
As long as it's not painful,
No.
then I wouldn't worry about it.
Okay.
But if it ever does become painful, it's really coming from the pelvis. Because why does your foot turn out in the first place? You got a rib out over here. Left short goes long. PI ilium. Let's figure out which, yep, here's your PI ilium. So this is the side that's posterior, and this is the side that's going forward. So her hips are like this. So lock down the sacrum. You're gonna lift this leg straight up as far as you can. Woo, and good. Now, you got some flexibility, other leg. Okay, good. And again, this side. Okay, and the other side. Now you're just showing up. This, okay, no low back pain though?
No.
No? Okay.
I usually have like a discomfort like in my middle back. I don't know if it's because I can't reach it when I crack it.
Yeah,
Or my posture.
yeah. It's your posture combined with not being able to reach it. Mostly posture though. Mostly if you can get this to come down. Do you understand that this is how I adjust it, right?
Yeah.
Okay. I need you to come back when you're in your day-to-day activity. I'm going to give you some stretches that will help you.
Okay.
Deep breath in. All the way up. Again. And out. This is the stuck ones. Yep. Oof. Again. Here's that rib. Again. That one's going to take me a little bit of work, okay? Right here. That's what you're talking about.
Yeah.
Yep, I believe you. School. Are you still in school?
Yes.
Yeah. Good. Just keep breathing. Good. Good. Here it is.
Mhm.
Ooh. Okay. The airport that makes a lot of noise. Oh, I can't just get this. Ugh. Well, I'll come back to it. You know, how often do you get your teeth cleaned? Twice a year?
Yeah.
Same kind of idea. It's good to have your spine cleaned out. Ooh,
Yeah.
there's a knot there. You okay?
Yeah, I'm good.
Yeah, there it goes. There you go. All right, done. Down the back of the leg, calf, little ticklish, and then over. Okay, done. Other side. A little different angle on this one. Bring it down to the hip. Doing okay?
Yeah, I'm good.
Cross your
Right
arms.
here?
Yeah, that kind of spreads it open. See that right there that I'm seeing? All right, problem here. And then just lean back for me a little bit. And then relax. So now I'm seeing this over here. Okay, go ahead and lean back again. So this fire's here. And then go ahead back again. That looks great. It's all the way down to the right-hand side here. She's got a little bit of a problem. I gotta come down the shoulder. Here we go, breathe. Free crack there. Is that your ankle? No, what I want is to get like, that's it, yeah, right here. You kind of know where I'm going, huh?
Yep.
Like right in this corner. Good. There you go. You know, the brachial plexus is right there. Hi, hello, ow. Yeah, that's not very fun to have that one worked on.
No.
Okay, very good. There you go. Deep breath in. Let's work together here. Here we go. Good. And again. Oh, I got a little bit more of one.
Yeah.
Yay for me. Yay for you. Deep breath in. Here we go. Oh, come on. Bounce with me, bounce with me. Good. All right. On her, it's on the right. It switches sides from person to person. But there's usually always one at around T11, T12. And that influences directly the low back. Right there.
Mm-hmm.
Okay, breathe. Breathe around it. There we go, very good. The quadratus lumborum, the lower back muscles attach here to the pelvis. I'm going to make sure that the sacrum, SI joint, all of that doesn't have any kind of, we don't want any catching, you know what I mean? I don't want, when I go to adjust this joint, I don't want anything to get caught along the way. I want it to just slide right in. Are you okay?
Yeah, I'm good.
Okay. I just felt you catch your breath, so I was like, okay, I better check in again. I'm pressing on your rib cage, you know. It's go figure, you know.
This side doesn't feel as bad as the other one, though.
Okay, good. Lower the shoulder down for me a little bit. Yep. Lower that shoulder down now for me. Yeah, there you go. Does that hurt though?
Mm-hmm.
No? Okay. Oh, there it is. Now you're bruising a little bit.
It's like the point of the scraper.
There's adhesions, like little pieces of glue that in the connective tissue here, and you want to get rid of that. You want your shoulder blade, you want your whole back to glide, and it brings in fresh blood and blood flow to the area. I'll promote healing. In Eastern medicine, they do it to get rid of fevers.
Really?
Mm-hmm. I don't know if that works, but I haven't personally seen that work, but I've read about it. You're trying to comb through that clump. I can feel it. You feel the little grains, like I'm going over like little pieces of sand, right? It's kind of what this is. So you want to comb that through. By running a straight edge through it, you break them up. The skin almost gets glued to the back, and you don't want that. You want it to be able to move. You want your shoulder to be able to move. You want all your bones to be able to glide. All those joints. Remember I told you I don't want anything stuck.
Yeah.
Because then guess what happens? When one piece is stuck, the other pieces have to move excessively to make up for the lack of motion of the stuck piece. And then they get irritated because they're not designed to do that much work. So then I gotta go, oh, okay, let me go find the stuck ones. And the skin and the fascia below it are a huge piece of the puzzle. Not just the joint. Everything from the joint all the way up through the surface, okay? The muscle, tendons, tissue, connective tissue. I think that's all you're going to bruise on this side. So, I can do your low back, but it's just getting red. There's no real bruising. Oh, there's one right here. Ooh, there's this rib. Remember that I talked about a rib at the very
Yeah.
beginning? Yeah, that's really inflamed there. It's just one, and there she is.
How did the ribs pop out?
Because you go forward, you curl forward, and then what happens is the spine feels it, so it goes to the side, and then it's like just to break the force, it pops out, or else it'll crumple. You know what I mean? It'll collapse, so it goes this way. It's feeling the compression, and it pops out. Does that kind of make sense? It's like if you were to crunch something, doesn't stuff come out to the side?
Yeah.
You know, if you collapse something like an accordion, it pops out just because it has nowhere else to go but out. So we want to get rid of that. We want everything to go from the back to the front. And then this becomes less severe, less problematic, less stiff, less pain, all that stuff, all that good stuff. The left side was bad up in here.
Yeah.
So let's try it. Let's go see what's, yeah, look, it's right there. Ooh, look at what was hiding this whole time. Oh my goodness. It's right, remember how we were working so much on the left-hand side when we started?
Yeah.
Well, here it is. Oh, there's your bruising. That's what you were wanting. Oh, that came out with no, barely any pressure. It just left her body. There you go. I'm going to give that a little break. It looks kind of brutal. So we're going to do the other side. I mean, I could really push into her, I suppose, but no, this is where it's all. I'm just giving you some counter pressure. Yep. So this one, I predicted correct that there would be a little one on the right, and I mean, I feel this with my hands, but sometimes the bruising happens in random places. And you're like, whoa. That I know feels good to me.
It does feel good.
It looks horrible, but it feels good. This goes away in about 4 days, okay? And then it's gone. Okay, I'm just going to put your head back against my chest. Yeah, and just kind of like that. These I just kind of open like that.
Do you feel it?
You can. If you dig hard enough, you can feel it open. Kind of yawn at the same time. So your maxillary sinus is kind of smaller on the left. And yawn, yeah. You'll feel it open. Go ahead, dig your thumbs in there. You gotta use your thumbs on yourself. Yeah. You'll feel it kind of pop open.
A little, yeah.
Or flex. Yeah, nothing ever kind of, fully fuses. The sutures and the bones, where the bones came together when you were a baby, they kind of always remain open. They say they fuse completely when you're 55, so you try to keep them as open as you can. People have surgery to drain that, and you don't realize how much fluid is in there until they start draining it, and you're like, oh my God. What its capacity is. Yeah, so here's that shoulder again.
I feel like the left side's worse.
Oh, really? Here.
Yes.
Here, yes, T1. But this, you got a whole clump of them over here. So what we can do is just come in here with the elbow. I didn't do too much elbow work on you up here. There you go. Oh, there you go. Okay. Bottom leg straight for me. You're gonna lean back. Yeah. Wow. Good. Other side. And lean back. Yeah. Oh my. Let me get a grip. Let me get a good grip on this. Perfect. I just still feel like those ribs are out of place. Okay. A deep breath in again. All the way out. Yeah. How about your neck? How does your neck feel?
Feels like it could crack. Do I crack it or no?
No, on your back. Well, let's see. I'm trying to problem solve
This
for
side
you.
feels like it could crack.
Chin back. Chin back. All the way back. Yeah.
No, relax though. Got you.
Ninja fast on you. I mean, or I'll lose my chance, you know. No, I got you. Right here. Nope, the side's closed, so you're right again. Now feel it. Did I get it all?
I think I'm good. Let me see my back. That's how I do my back.
That was up high?
That was like, it's like right here. It's like right here.
So you might be causing this rib to come out.
Oh.
Yeah, yeah. Because when you pop, look, turn that way, watch.
So,
Yeah, look. This is the one I'm talking about right here. Okay, my camera girl deserted me. How do you feel?
I feel good.
Feel good? Okay. Feel loose?
Yes.
Feel like you need to take a nap? You look tired.
I can take a nap now. No.
Yeah, so there you go.
And then I just bend them forward.
That's fine. There's nothing wrong with that.